Board of Health meeting. Just a disclosure, this agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. So I'll call the meeting to order at 6:08. And Mark, you have anything to say?
Yes, I do. I hope I will be quick because I know you got a good agenda. Good evening, everybody. Happy New Year.
Happy New Year to you.
Happy New Year.
Okay, and I got 3 thank yous to put out. One to Raj, who found out what my telephone number is, and we talked about, again, the booster shots. And I thank you. You did send the paramedics out. It happened last Wednesday. Ed Bourbon, thank you for putting the name there. My name, my father, and my name. And we got boosted at the same time last Wednesday, about 10:30 in the morning, and we're all set. And the other thing is, I just watched Channel 25, and they had a report from the T station about how well it was being run. So I would check on Raj and Ed for that, for saying there probably was a good organizational skills to all together to work together. So I said, those are my thank yous. And the boosters we got, and I thank you, Raj, for calling to set it up. And Ed, I thank you for pushing it through. And everything is all set here. And my dad and everybody's been healthy and strong. And this 22 stays the same way for everybody. Thank you.
Mr. Mark, I just want to say, train station is all Sergeant Berman. I have a very little role there, but thank you. Thanks, Sergeant Berman, who have put this in place, so.
Yeah, thanks, Ed. Thanks, Mark. Okay, speaking of Ed, number 3, COVID update. You're up. How are you?
It's been, Raj and I have been busy.
I'm sure you have been.
Yeah, so a few things, everybody. So as you know, we actually put out a couple of reverse calls over the last couple of weeks, just because the amount of cases coming in. For example, on Monday, even during the height of COVID, back in the wintertime when COVID was our spikes, at any one time, we would have about 50 open cases, because you got cases coming in, cases closing out. On Monday, when we came in, Raj and I were trying to get through a total of 274 open cases. It's pretty dramatic, the increase. And it's not just us, everyone, obviously everybody around us is experiencing, in the country, we're experiencing these large numbers. I think Raj figured it out today. Yesterday, there were over 1 million new cases in the country of positive COVID. So with that being said, we're kind of struggling with the new guidelines that came out because it leaves a lot of interpretation of each case. So we've been Raj and I have been working through that, to get a better handle on it. And again, we thought that the guidelines were going to change again today at 3 o'clock. Raj and I were both on the DPH call, and they didn't say anything that we didn't already know. It was an hour we're never going to get back from our lives. But beside the point. Anyway, train station, as most of you know, we went to an appointment-only system starting this week that has significantly reduced the amount of traffic. It has reduced the stress level there. And it was just something we had to do. It just got out of control with 800 to 1,000 cars trying to get into that parking lot. Also, some of you may or may not know, on Monday, Wednesdays, and Fridays, the hours were changed to 9 to 1. We did that because the representatives from the MBTA contacted me because commuters were having a hard time getting to the train station to get on their trains. So we agreed to change the hours, and Transformative Healthcare was great, very easy to do to get them to change that. again, we're just working through all these cases. Obviously, we don't have the ability right now to actually call every single case that comes in. So what we've done is we've gone to a letter system. So we've been pulling names out of Maven and doing mail merges, and we're literally sending isolation and guidance and quarantine information in the mail to people. And at that point, I'll just kind of leave it for questions for right now.
And do you have any statistics on the age range? Are you seeing mostly unvaccinated kids, or is it all over the board?
So I will definitely tell you, we are definitely seeing more positives in unvaccinated and unboosted people. The numbers are very low, people that have already gotten their booster.
Okay. Yeah. How many tests are you running, a day at the T-stop?
So I haven't gotten any data this week yet from them. I usually get that toward the end of the week. So I'll see what the numbers look like at the end of the week once we get the numbers from them with the appointment system.
Yeah. Last time I think you said it was about 400 a day.
Oh no, we were doing 800 to 1,000 a day.
Oh my God.
After Thanksgiving. Oh yeah.
That's incredible.
We were doing 800 to 1,000 a day. It was crazy over there.
Yeah.
Yeah.
Okay.
And what's
Right.
the age range, Ed, for the positives?
Oh, it runs the gamut. I mean, but you know what's interesting? We're definitely seeing, those younger kids, in daycares and things like that. But it really seems like the cutoff is around 65. We're not seeing a huge spike in the older population right now at all.
Mm.
Interesting. I guess they're staying home or, otherwise, quarantine.
Well, again, but think about it. They were also the first to start getting boosted also. That
Yeah,
group.
that's true. Jay, Di, any questions?
Well, I was just gonna say, I mean, I don't know if you have an opinion or we can collectively agree, but it just seems like the volume, as you probably all know, that Susan Roby and I answer the COVID hotline every day. And it's actually, at this point, to be honest with you, it's upsetting when we have to tell people there's no appointments available, because there's just not enough tests for everybody, because it just seems like every single call, nobody can find a site. I mean, we're getting calls literally all over Massachusetts. People are now at the point going to New Hampshire to get a PCR test, whether they're traveling or they've been exposed or they want to do it because they choose to do it. But there's just not enough tests for everybody who wants to. So for me, it's like over the last few weeks or even the last couple of months, it seems like yes, the numbers are larger because of the spread, excuse me, the spread of the virus, but it's amazing how many people want to get tested. And at this point, people want to get tested because you hear, your neighbor or somebody down the street say, I didn't even know I was sick. With the last strain, it just seemed like people were like, oh, I didn't feel good and I kind of knew something was wrong. But it just seems like there's more and more people that said, I didn't even know. I had no idea. I had no symptoms. So it's just really bizarre to see, I've been trying to pay attention to the trends, and all the information that, Ed and Raj send over. And then dealing with, the customers on the COVID hotline. It's amazing to me, like where we're at in this situation, I'll call it, because I know at the last meeting we talked about, possibly doing boosters and things like that. And, here we are a month later, and now we're like, I mean, for me, it's like my focus is getting people tested, because there's so many people who call in the whole Commonwealth of Massachusetts who cannot find, even at a pharmacy, they cannot find a testing location. So hopefully this is our spike and it's going to go down. But what scares me is the people that are, potentially sick now, because we've had this spike, the people who potentially sick as we speak, they can't even get tested. So, I know it's kind of jumping into our next conversation, but, the thing is, the state can't test all the people that need to be tested or want to be tested. And it's concerning to me because, we talked, I know people have been talking about doing a mandatory mask mandate, And I kind of think the damage is done. It just seems like there's a lot of people literally as we're speaking now who are scrambling for many different levels. And it's almost like I feel like that we need to just do an advisory that everybody just wear a mask from here on forward, because you can't even get tested. You just can't even get tested. And it's, I mean, it was literally at the point today, it's like, you wanted to just, some of these people have a heart-wrenching story to tell, whether they have a 2-year-old child in their car and they're driving around looking for a site, or somebody's, sending their, mother to a daycare facility and they don't have a testing facility. So just wanted to put in my 2 cents that it's, it's amazing where we are now compared to where we were a year ago.
Thank you. I mean, there is beyond doubt, these tests are very scary right now, but thank you for what you do in the office, taking all those angry calls. We do see that too, like few here and there, but there is so much we can also do, just because of the unavailability of the test.
Right. Yeah, that was pretty much exactly what you said, Di. That was the lead story on one of the national news broadcasts last night, where there's just, that's countrywide,
Absolutely.
not just there. Not that that's good, but I guess we weren't prepared again as a country for a surge like this and people wanting to get tested. So, yeah.
Yeah, and I know it's a segue into the next conversation on the agenda, but
Yeah.
the thing is that with that being said, even the Commonwealth, they're not able to provide that service for the residents. And I know other people have pushed out advisories. I know, Sergeant Berman did an advisory recently. Jim Adams did one, which I think those are very, very helpful. And I think the more we educate people to, at this point moving forward, is to just assume you have it. You need to assume that, because you can't let your guard down, because we literally don't have any place to send them to. If you're traveling in a couple of weeks, yeah, you can get a COVID test if you schedule it 2 weeks ahead of time. But, as of mid-afternoon, the next test date and time for our, for the state's facility here in town was next Thursday, the 13th.
Yep.
So that's my 2 cents.
Definitely a problem.
Yeah.
Okay.
Ed, I just had a question. Sorry, I came in late. Just like with, I noticed like in Boston, they're giving those self-tests. How would we be able to get around to get those? Because I feel like if we had those, if people are able to test themselves at home, the ones that would really go to a facility to get tested are the ones with like symptoms.
Yep.
But hoping that if people are able to test themselves, if you just feel like you've been exposed and you can test yourself, and if it's negative, and then you're fine.
Right. Under that program,
positive, hopefully they look for more help.
Yeah, Barbara, under that program, Ashland was not eligible. We didn't meet the criteria for that. Those test kits from the state went to like Framingham, Lowell, Brockton, Worcester. We were not eligible for those test kits. The state did put out an advisory the other day that we can now, quote, buy test kits to give out to the public. But I don't know where we would even budget for something like that. And we can get the state pricing. That was the memo that they sent out, right, Raj? Just that we can buy them.
Yeah, maybe we can get a federal loan for that.
Yeah. Yeah, but we were not eligible under the free test kits.
Right.
Oh,
But
okay.
Ed, correct me if I'm wrong, the schools did receive it for their faculty, right?
They did, yes, but DESE did that for all the school staff over the weekend picked up test kits, and they all were required to test Sunday night before they came in to the building on Monday. All school staff.
I'm just curious, Ed. So when people do self-test, how do they get the results? Do they like log in somewhere, or was
No? So on the home kits, they actually do it right there. I shouldn't say it this way, but it's like a home pregnancy test. They do the sample, drop the solution in, and in 15 minutes they get their result.
And they have to report the results?
No, they don't. And that's, think about this, remember I said at the beginning, Monday, we had, when Raj and I came in, I had 274 open cases. But think about all the people that did home tests that we don't even know about that were
Exactly.
positive. Yep.
Exactly.
We don't get any of that information.
And the problem is they'll continue going on with life as if there's nothing wrong.
Right, right.
And that can be concerning, you know. I mean,
Yeah, that's concerning. Home tests.
if that's the case, you know, if we don't get the information and there is no follow-up on the context and all that, that can probably do more damage than good, you know, so.
Right.
Exactly. Yeah.
And then my other concern too is, you know, some companies have purchased like these home kits for their employees. But, you know, think about it. You know, if you've got an employee that can't miss any work, right? How do you know that they're actually swabbing to begin with, or even swabbing themselves properly?
Exactly. Yeah.
You know, you don't know. It's the big unknown.
Yeah, absolutely.
The never ending.
Well, and again,
right.
that, you know, about, you know, a mask, you know, I guess it's referred to as a mask policy, but, you know, what's concerning to me is that, you know, because we, you know, collectively are getting a lot of calls and getting a lot of different feedback, I'll say, about the state testing facility. And I think that if we do a mandate, I think we are going to literally get inundated, because it's, I mean, we were averaging, Susan and I were figuring we were averaging, excuse me, I can't talk tonight, 15 to 20 calls per person per day. Well, honestly, now we can't count. There's no way we could actually count. We can't, the two of us together, I mean, Ed's been doing the same thing. He's been answering the calls too. But my concern is that, if, you know, I know, you know, Rob Scherer is, you know, wants the board, the select board to talk about tomorrow night about doing a mask mandate. I think it's educating. I don't think a mask mandate is going to help solve the problem. I think it's educating people to protect yourself like you are, like you and everybody else are positive, because you can't get tested. There's the reporting, the quarantine requirements have changed. There's so many things that have changed that you just have to go on and this is my opinion, of course, you know, that act like that you're positive and take all the necessary precautions.
Right. And also, and Diane, just to piggyback off of what you're saying is, who's going to enforce it?
Well, and that's the thing is people are going to call and complain, and you take the complaint, and unfortunately the complaint doesn't really go anywhere. And basically there's five people that will take the heat saying, well, you know, you can enforce it. Well, you know, our police officers are busy. We're not going to probably use our firefighters to go to these establishments.
Right, but it's not a police function either.
Absolutely. But that's what I'm saying is when
people
think we have all these other resources. We are a fairly, you know, small community. And again, you know, I mean, you know, things have changed, and I think we just need to educate people. And I think what you know, Ed did, and I think what Jim Adams has done, I think more of those calls to just remind people that we are literally in the height of it. I mean, clearly this is, I think it's the most cases you've had in ever, right?
Yep.
And I think you gave the numbers. Framingham had like what 400 and some odd in one day.
So Friday, last Friday, on New Year's Eve, we got 65 new cases in overnight on Friday. Framingham got 415.
And that's from, I'm making an assumption because I'm not doing the math and looking at dates, but I mean, that's just from a Christmas holiday break. I mean, people obviously got together with their family, friends, whomever.
Yes.
And then, so, I mean, we potentially, I don't think the 5 days isn't until tomorrow, right? I mean, we might have a few more days of the New Year's spike, I'll say. So even as we speak, we are not being televised live, but I think we need to push out to people that you need to, from literally this moment forward, act like you are positive, wear your mask, properly wash your hands, you know, use hand sanitizer, protect yourself, because we're not even in that window yet. And the numbers are going crazy.
Right.
We'll definitely push more through our social media, you know, tomorrow and coming days, just educational material through the social media as well, you know. I mean, Sergeant Berman did 911. There was calls, you know, but we'll do some more social media outposts, you know.
But I think that is good also, Raj, because I mean, you know, you have some older people and things like that. I think there's a lot of people, I think we get people's attention by doing those calls.
Oh,
Sometimes people
absolutely.
think they're a little bit annoying, but I think also if we, you know, just change the message just a little bit, just to, I mean, like really, and I know, you know, Ed, you did, but like really emphasize that, you know, our team is in that heat. Tests are limited, you know, and, you know, if we can make a suggestion, you know, and hopefully all agree, just act like you're positive or act like you've been exposed or just you need to protect yourself because of where we're all at.
And it's true, Diana, too. It's because right now it's like most people don't even know they're positive because this variant that's going around, most people don't have symptoms. So it's, I feel like
A
we're
lot
all
of people
positive
still
at
do
some
have
point.
symptoms, but
Yeah.
you're right. It can spread without symptoms, with symptoms,
Mhm.
or semi-symptoms.
Right, and I mean, Ed, I know, and Raj have been talking to people, but my understanding is that the symptoms this time are, you know, very different from before. People had more cold-like symptoms and they're a lot milder this time versus this is like more of a runny nose versus before was more of a stuffy nose. So, I mean, who knows? People, it's the heat in my house. It's,
Yeah.
you know,
And we
so-
definitely see the difference between the unvaccinated and the vaccinated. The unvaccinated people are the ones that are really sick. We definitely see that across the board.
Now, would your recommendation, I'm looking at the two of you because you're in my right screen, but I mean, would you agree that the recommendation to the select board should be to educate and advise versus mandate? Is that where the two of you are at this point for the board's perspective? I mean,
Yeah.
Absolutely, you know.
And
and
again,
that-
right. And again, Diane, it's because we don't have the personnel to be out there enforcing.
Well,
And, you know, and to answer complaints, you know, Mrs. Jones was walking down the sidewalk and didn't have a mask on.
No, I mean, we have more important things to do, you know, again, I mean, I'm happy to go wherever we need to go, you know. I mean, from public health standpoint, it's important, you know, it will help. But right now with the resources we have, we can definitely use in a better way, like educational, you know, contact tracing, more of vaccine clinics, or wherever we can go, you know, like that's my opinion too. That'll be more helpful than going after people who just not gonna listen to us, you know. It's that very few of them, I mean, I don't know how to even control them, you know, because if we have to put something like that, we have to come up a little solid, like, you know, there should be a fine structure or there should be some sort of consequences if you don't follow that order, you know. I mean, that's my opinion, please.
yeah,
Yeah.
maybe we should just educate everybody.
I mean, I'm not trying to hijack the meeting, Ron, but I mean, would everybody agree with that? I mean,
No,
because
no,
we
I,
do-
no,
You
it's
know, I mean,
interesting, you know.
Yeah, I
We
do
just may
agree.
as well reverse 4 and 5 and just continue just, you know, redoing this, and then we can do the animal health. But yeah, I mean, I have mixed feelings on it, you know. Generally, you know, there's no hospital setting where you can't be masked, none that I know of. Every single Mass General, Brigham Hospital, and I'm sure every single other hospital. My daughter's at a consortium of five hospitals in Hartford. Patients and doctors need to be masked at all times. So that's the way I live. So I'm used to it. You know, now we've had some employees of ours that have come down with COVID, not from being at work, but from being in close contact with people outside of work, not masked and not social distance. So in my opinion, you know, we can educate people all we want, Diane, but you can educate people that the vaccine is good, and there's going to be people that you say the sky is blue and they're going to say it's yellow or green or purple, and they're not going to do it. So universal precautions, which is exactly what you said, is what you need to do, because there's no way that it doesn't work. I have not been able to find one either scientific or medical literature or journal that does not espouse the use of some type of mask covering that reduces the risk. You know, there's all kinds of variables. There's what you use, there's how well the mask fits, but there's no doubt that it decreases the spread. So I don't get how you're going to educate people who don't necessarily care about anybody else and hide behind, well, it's my country, I can do what I want. Meanwhile, you have as many cases more cases than you had, even though the symptoms are less severe for a majority of people, yet you're still having hospitals that are inundated, emergency rooms overwhelmed with COVID people. You have hospitals starting to limit elective but more urgent surgeries, like my mother who needs a valve replacement. Now she can't get one yet because the hospital isn't doing that, because too many people that are unvaccinated and aren't wearing masks are continuing to transmit it. There's a lot of, there's places that are mandating masks. I don't think we are, but I know the schools in Framingham are. You have to be masked to go to school. So I don't see what the difference is. And especially with kids that are unvaccinated, since they're taking up a lot of the hospital space, it should be
Schools
mandated.
require
At
all
least,
the children and staff to wear masks at school. All of our
Okay.
municipal buildings are required to have staff.
So what's the difference when you have somebody either going into a store or a restaurant? If you don't want to wear one outside, to me, the transmission outside is completely different than inside. That's pretty much proven as well. And nobody's social distancing inside anymore. There's zero ways to, when you check out at Market Basket or Shaw's, there's no stand here, don't social distance. There's no arrows that say one way anymore. So you have most people, I observe, are wearing masks, but there's still some that aren't. I don't know that mandating it is or isn't going to make them wear it. I just think it sends the right message that this is what we expect. And the scientific evidence is pretty sound. If you look at any of the literature, I've tried to do searches where there's any scientific or medical journal that espouses not using masks, and I can't find one. I can't. So, I do understand the enforcement policy. I don't expect you to go out to do it, or me, or Ed, or any of the police people, or Roz. I agree you don't have the time, but if you just keep letting people do what they want to do, then now we're where we are because of of both of those things. Close contact inside during Christmas, during New Year's, during Thanksgiving. I mean, there's a reason. If you look at the numbers and the spikes, the exact same thing happened last year. Exact same thing. You see that spike starting around Thanksgiving and going through New Year's, and then slowly declining over the course of the winter. That's what I see. But
I agree with you, but I think also why I'm leaning more towards education is because I think with our loved ones, we tend to forget that our loved ones can be sick too. They could be carrying COVID. So I think that's why you see it more around the holidays, because people, like
Can you
we
grab,
say,
call him with you? He's just pawing at me. Oh, sorry, guys. I know I wasn't.
I'm sorry, say that again,
That's
Barbara.
okay. Like during holidays, like say my family comes in, if I have my son who's in college, he comes in, the other one, my aunt or my niece, you forget that when you're around family, you forget that your family could be carrying COVID. So people get more reluctant around their family. And I feel like that's where they're getting it more than just walking into a grocery store, because people might pay attention when they're at the grocery store. Like you said, some people are still wearing masks, but I truly feel that's not where we're really getting it. If the kids are wearing masks in schools, then that's fine. But it's also when they go and you're at home when you have, because now you're taking your masks off, even if they come wearing them, everyone is sitting at a small table where you're not social distancing and you're all having dinner at the table.
Right.
So that's where
to me that just makes a point to do it, not to not do it.
Yeah.
I mean, that it doesn't make any sense to me to say, all right, well, you know what, we're more at risk for getting it inside because there's less ventilation. it's an aerosol borne thing. It can get into your eyes, and get into your nose, and get into your mouth, and get in, and gets into your lungs. So there's multiple routes of transmission that you can't necessarily protect against all of them, but it's one of the primary ways is breathing in those aerosol particles. So how do you protect yourself when you're inside? If there's one thing to do that can prevent at least the spread, I don't know what else to do. So I don't know why, for the good of everybody, we are a board of public health, right? So we can educate all we want, but we have the ability to put this in place if we so choose. And that's just my opinion, and everybody's got their opinion. That's fine. I'm trying to back mine up with scientific facts. And I know there's no perfect, there's going to be people that aren't going to do it no matter what. And, if you don't want to do it, that's fine. But that's all the more reason to do it, because you have to use those universal precautions even when you're home, because people are getting it.
Question, what would be the downside of mandating it but not being able to enforce it? I mean, the upside of the mandate is you might get more people that wear the mask. And if you hadn't mandated, and then, I mean, it's going to be incredibly difficult, if not impossible, to enforce it. What is the downside of not being able to enforce it? And I'm, I really don't know the answer to that.
Neither do I. But I think mandating is better than just leaving people to choose to do whatever they want. I mean, much as we cannot enforce it, we don't have probably the manpower or the money. But if we mandate, I mean, people who care about others will wear masks. Those who don't care will never wear them. So, but you can't just let people choose to do whatever they want. That's just my opinion.
At least you'll get a higher percentage wearing it. Than not doing anything, I guess.
And I agree. I mean, I agree with, Ron. I mean, he's a doctor, and we all watch the news. We all listen and look at Ed's statistics and do all this. But, what I have a hard time is the first thing I'm going to say, the damage is done, I think. I mean, to have this many cases that are in now, I mean, we can, if the board decides collectively to set a mask mandate, let's just throw out a day. Let's just say as a Friday. We're however many days, 7 days, I guess it is, or 8 days after New Year's. I'm assuming, I'm going to make an assumption that the cases are probably going to jump between now and then. They're only 5 days, so a lot of them are going to drop off. And then now we have a mask mandate for people who they're out of their, I mean, let's face it, the quarantine period is only 5 days now. That's the way it is. But to not have, I say the corner office, I mean the corner office in Boston, set something for the whole entire state because of the uptick and the lack of testing facilities and the way that this variant is being spread. And I mean, I feel like there's a list of reasons why the corner office in Boston should have done something, a little while ago. I just have a hard time mandating what people do. I feel that people are hopefully well educated on what they're supposed to do. And I'll stand by my board members if you collectively want to vote and issue a mask mandate. I personally am not in favor of it. I think that this whole entire time, I mean, it's been a long process, but I think this whole entire time I would give the residents of Ashland and hopefully people who come to our community the benefit of the doubt that they're intelligent enough that they know to protect themselves and wear a mask. If they choose not to, they choose not to. But what's happening right now, I don't know that it's necessarily related to, somebody could be getting it from the grocery store. Like Ron was saying, there's no lane. I mean, there's the grocery store. I think that's the closest I get to people in general. There's a lot, it's very close proximity. I go to Market Basket. But I just don't personally like mask mandate. But I mean, this is why we're a board. This is why we have these discussions. And I would support my board members if you wish to move that way.
Well, I think I think it's a good chat, and I think to listen to what the select board has to say tomorrow and try to come up with a with something everybody can agree on. And, I don't disagree with what you're saying either, Diane. I don't necessarily like to tell people what to do, but I think it's, an extraordinary circumstance that we haven't ever seen. And I don't know what, other than education, and I think there's a ton of it out there. I'm still amazed when I see somebody not wearing a mask. I have people coming in here, and I'm in the rooms, and their masks are down over their nose, and 5 times a day I got to say, hey, please put up your mask, because I'm dealing with people all across the board in varying states of health. A lot of people, and I certainly don't want to give it to anybody. So, I'm trying not to do anything. I'm not saying I don't go out to eat, but I think that everybody that's in those places, people are, you look at the airlines, they can't get enough crew members and things to get a lot of these flights going. So if that starts happening to local businesses, not only the owner's going to lose revenue, we'll lose revenue, tax revenue from restaurants or stores where people aren't going to go. It just seems like sound medical common sense to me, but nobody, or there's still people that don't want to follow that. So I don't know how else to educate them, to tell them to do it. There's enough evidence out there. You can always find something to the contrary, but that is not mainstream. If you do a search, you're not going to find anything that says that you shouldn't mask. Nothing that I can see.
And I think also, and I know we've talked about this, and it's been some time. I had Laura pull the vote. I mean, when this originally started, we basically threw the ball into the town manager's hands to make emergency decisions, as fit, because we were in an emergency. It was a literally at the time we were voting by email because we couldn't be together. So I think the thing is that they're going to look for a recommendation from the board tomorrow night. So I don't know that I don't. I think the board collectively should come up with a decision tonight. And I work until 7 p.m. So if I attend, I will likely be late. Don't wait for me or anything. But I think the board should make a decision on what their recommendation is. But that's just
and I think that I think that they are going to look to us, and that's why personally I'd like to understand. Like I can understand the issue of personal freedom and all of that, but to say it, and also I liked the advisory idea too when that was first considered and rolled out. But to say that we won't mandate it because we can't enforce it. Now, I'm not in law enforcement, so I don't know how that works, but would we not mandate it because it can't be enforced? Would that be a reason for not mandating it? And like, what sort of scenarios would we be expecting? Would be expecting a lot of phone calls, complaints? Like, what is it that?
So I can answer that. So Jay, when COVID first came out and the governor put out the initial mandate for mask use out in public, we were inundated with phone calls, people complaining, Market Basket, Shaw's, name it. And I used to spend literally like a quarter of my day every day going, because we were mandated at the time to investigate. And I would go to Market Basket, and of course, right there, and the manager would say to me, "Okay, there was one customer that we didn't see. What do you want from us? Because it would be another customer complaining. And obviously by the time we get there, it wasn't an issue. We had, and then what happened was, we had an issue with some of the gyms, and then so some of the gyms didn't comply, and then we had to refer it to the state, and then I mean, every day we got a call about Market Basket and Shaw's. There was quote a customer that didn't have their mask on properly. And it was every day. Mm-hmm. And I would say to people on the phone, okay, if I drive over there now, that customer is obviously going to be gone, and then people would get angry because we didn't immediately go to these places. It was almost impossible.
So Ed, you're on both sides, right? The medical and public safety. So do the benefits of it outweigh the risks? I mean, you've seen both.
So first of all, if we look at it's not a police responsibility.
Right.
That's number one. It is not a law enforcement responsibility to enforce a mask mandate. And I don't think you'll ever find a police department that's going to be told to do it anywhere.
Mhm.
And you know, listen, from the public health side, yeah, I love the idea. We can just do advisories and we can do education, and I think when you mandate people, it's almost like you're almost challenging them to not wear their mask.
Mhm. Yeah.
And I just want to add my 2 cents, as a public health professional, I will love the mandate. This is beyond doubt. And Dr. Ron, beyond doubt, preventive, that's the best thing you can do. But from the enforcement side, as Ed Berman said, it's hard. Those calls, if we don't attend it, that's again my reservation. If we are putting it on, we have to enforce it. I mean, putting a mandate and then not enforcing it is, again, already we have a very weakened public health system, at the level, it'll be like, oh, okay, so I don't care kind of situation. And what happened with the mandate when the state did it, I want to give you an example from Watertown, that we was enforcing it. We even issued fine because there was $300 fine, we issued it. And one was challenged in the court, and the magistrate took not less than 1 minute to throw it away. So those are the challenges. Again, I wish the staffing, I had few more resources in hand, to do it. But again, I'm totally with the board. I'm the agent. So I'm for it, but that's like my little hesitation. Like, hey, we need to work on it if we mandate it.
And I want to just say, based on what Raj just said too, think about it. Even if we did do a mask mandate, we don't have the authority to do a penalty, really, right? I mean, and how are you going to do it?
And such, it should be on. If you're mandating it and if you're not following it, there should be some sort of penalty, right? Watertown did it a couple of weeks back again. They did a mandate and there is a $300 fine. It's on it. So enforcement part, I mean, that's like my little hesitation again. And again, I'm totally for it. As a public health professional, I will love it. But that's a little thing. Those calls when public calls us, right? Like, hey, for their concern, if we don't attend it or don't respond to it, that'll be my hesitation again. So
Do you think, Raj, that there's more damage done by the message that's being sent if it can't be enforced?
So I can't clearly answer it, but like we have an advisory, people will follow it, but I won't be, I don't have a clear cut answer for this,
Yeah, because that's what I wouldn't want to happen, is that it's sending some sort of message that it's okay. And like, Ed said, maybe some people just dig their heels in or defiant or whatever. I mean, I don't know if that would happen. It's possible, I guess, but if
sorry.
yeah, go ahead. No, go ahead,
I
Diane.
was just going to say, and maybe this might be, I have a kind of twofold. I am being a little selfish here as well, because like I said, I answer the COVID hotline during the day, and I kind of feel the same way. It's like if somebody calls and says, hey, there's somebody at Market Basket, or we keep using Market Basket, but wherever, it's like, who do you send? We, as you probably all know, we don't have Ed every single day now. Raj has a lot of things on his plate. Here nor there, we can take the call, we can see what we can do. That's fine. So I kind of feel like for myself, it's like almost like mud on my face. Well, you did a mandate, but you can't enforce it, and shame on you. Now you get the calls and now you get the complaints. But with that said, I'm wondering if our approach should be a little bit better if we ask the businesses strongly and say, hey, this is what we would like our community to do, is require them in your business. You have every right as I say Market Basket again, but you have a right of Diane's, convenience store to tell or ask people to wear masks in your facility. And we're asking you to participate and help us educate the community and educate the residents and, you know, people coming into our community to wear the mask to protect themselves, as well as the people behind the counter, the people who are working there. And maybe even, because I know, again, you know, Rob had mentioned Ashland Ale House. And, you know, if that's a concern, of course, you should be having your mask. And maybe you ask them to wear their mask, or maybe the people at, you know, Ashland Ale House will just ask their employees to wear masks because of the, you know, the outbreak. So maybe if we approach it a little differently, instead of mandate the residents and the community members to wear it, is maybe we ask the business owners, hey, would you be willing to require people to wear a mask in your facility? It might be, again, it's not really enforced, but I mean, it might be a little bit easier, and we might be able to solve the same problem and come up with the same solution. Just thinking.
And I just wanted one more thing real quick too. I think we would actually be having a little bit different discussion also at this point if we were like, if everybody around us was doing something, Framingham, you know, Holliston, but none of them have done anything yet. So, you know, it would, I think this would be a completely different discussion if everybody around us was kind of trying to do something at the same time. And I have to go answer my door. I'll be right.
Right. No, go. No, well, you know, just, you know, I mean, obviously I'm all for the masks like Raj is, but I can't ignore what Diane said, what Raj says. I know he's for it, you know, if there was an ability to, you know, really enforce it, which apparently we don't have. You know, Diane answers phone calls. I'm sure she'd answer plenty more, and she probably doesn't have time to do that. Ed certainly doesn't have the time to do it. So if you're telling me that the strong advisory and, you know, education is the way to go, then I'm gonna defer to you and all of you, and, you know, Diane, Raj, Ed, and, you know, I think you know, Barbara as well initially, even though it doesn't, you know, come up to a medical standard, which I'm not putting everybody to, but, you know, it's still mandated whether or not you want to wear one or don't want to wear one anywhere else. You're wearing one to come to the hospital, or you're not coming into the hospital. You know, as far as being an employee, you don't have to be an employee of Mass General Brigham if you're not vaccinated either. So that, you know, that's all thrown out here. It's a different environment. I get it. But, you know, I'm
And Ron, that was kind of my point
just
about
do the strong advisory. Yeah.
That was my point about maybe the businesses signing on, is just like you said, when you go to any medical facility, it doesn't matter to what level, you're required to wear masks. Those are the requirements.
Right.
And maybe if our businesses, and I know that, you know, we have, you know, resources to send out notification to our businesses asking them, and maybe we'll find that they will, you know, say sign on to it. And just like, you're required to wear a mask in my facility because we want to protect you and protect ourselves.
No, and
So
I think that's a great idea. And to that point, you know, I kept an eye when I was in Market Basket over the weekend. I did not see one employee that did not have a mask on. So they might be asking them to do it already, but not necessarily advertising it. And actually the same thing, I went to Shaw's as well, and I didn't see one employee that I thought was an employee without a mask. So could be right. Jay, what do you think?
I agree with you, Ron. I would defer to the folks here in the trenches, and I think that's a great idea, Diana, in a good, you know, middle of the road or compromise, if that could be done.
I think after, you know, after the board, or after, you know, Ron speaks for the board tomorrow night at the select board meeting, I think we could, you know, collectively, you know, I mean, Raj could probably, and Sergeant Berman can probably, you know, draft a nice letter to the businesses. And our economic development director has, I'll say all the businesses, and maybe we send out an advisory to them. And if it could be an advisory that they post, maybe we can draft something for them saying, you know, just to help them out with the process. And let's see how many people bite at the apple, and it might take care of what we're looking for, is to protect the employees as well at these facilities.
We'll work on it, you know, so if that's the case, we'll definitely look into that.
Barbara, Bernadette, any comments?
Yeah, I agree with that.
Okay. So
Yeah, I agree.
You do too? Okay.
Mhm.
All right. So we'll just do the strong advisory and we'll see if, Raj can set something up potentially with the store owners to at least have their employees, wear masks, if they feel that it's warranted, I guess, however you want to put it.
I would see, Ron, that also, I mean, for the board, is that, I mean, the employees, but also required that the people like coming in, attending their facility wear them, you know what I mean? So even, like you said,
Right.
it seems like a lot of the employers have their employees wearing masks, but maybe if they would just, instead of us mandating it, that they can requirement for their facility, you know what I mean? That kind of so it's protecting both sides of it.
Okay. Is everybody planning on attending that? Because I know we have it posted, tomorrow night. I know, I'm going to be Jay and everybody else. Are you planning on attending that as well? Just that portion of the meeting?
Yep.
For the select board?
I'll be there.
Yeah, I'm
Yes.
planning to, yeah.
Yep.
Yeah,
Yep.
I'll be there as
Yeah.
well.
Okay. All right,
I will,
good.
I will try to sign
All right,
on. It
good,
might be a
'cause I
little
think,
late, but I'm gonna try.
Okay. All right. Thanks, Di. Okay. All right. I think we beat that to death for a while, so that's great. So since we kind of, switched 4 and 5, had everybody had a chance to review agenda item 4, our Ashland Board of Health policy regarding the keeping of animal regulations. So we were going to vote to adopt that. This was kind of Diane's baby. She did a ton of work on that. Thank you very much for that. I know you worked with the, not Donna. Sorry, who'd you work with on that, Diane? Is it
Donna,
Donna?
yep,
Okay.
yep, Donna's
Yeah,
on
Donna.
tonight.
Okay, so it is Donna. Okay. So
Yeah. So the only thing I mentioned,
anything that you wanted to say, Diane?
I just wanted to mention at the last meeting, there was an email we had received from a resident that I think, I was reading between the lines, so to speak, because there was some questions and concerns about the regulations. I did not personally contact the person. It wasn't a number or the holidays. It slipped my, it got away from me anyhow. I tried to follow some of the concerns to see if there were changes that we possibly wanted to make. And I really didn't, I'm assuming Donna, and you can say something or not say something about it. I assume Donna, you probably saw the email and maybe looked at it. I, respect their email, but I didn't see the need to make the changes to the regulations. So I'm not proposing making those changes to the regulations. So the last draft that you had or have, I don't have any changes to that for the board. So if everybody was okay with the regulations, we wanted to make sure when we had Barbara's okay. I just want to make sure Barbara was still on. I wanted to make sure we had a full board, because that's usually as a courtesy, we wait for a full board to approve the regulations. So if the board so chooses, we can vote to adopt the new keeping of animal rules and regulations for the town of Ashland. And then we could discuss an effective date. Just to reiterate, just to remind everybody, this does not affect people that currently have animal permits, only if they make a change, add, delete, or make a change to their current situation.
Can we consider that a motion, Diane, or do I have to
I can make
officially
a motion. If I can make a motion.
Okay.
Unless does
Sure.
anybody have any questions, or is everybody okay? I think same thing. I think we beat this one for a while, so I think we've been talking about it for months. But
Right.
I'd like to make a motion to adopt the Town of Ashland Board of Health rules and regulations relative to, I can't even say it, exemption, housing, maintaining, and keeping of animals, dated January 4th, 2022.
Second.
Anybody second that?
Yeah, no second.
Second by Jay. Okay, great. All in favor?
Aye and aye.
Hi, Bob.
Any opposed? No? Okay.
Okay, so now
Passes
what
5
we would need
nothing.
to do is discuss the adoption date. So usually, of course, we post it on the website. Just, I say make it known that the board adopted the regulations. So I think in general, I think that if we give I think if we do February 1st, that gives 30 days. Like I said, I know we're not dealing with anybody who's having any concerns with the regulations or anything. So I think February 1st to become effective, I think would be reasonable. Unless the board wants to make it today. It's really, I think it's one half a dozen of the other, but.
Yeah. I think that's good, Di. I like that. Is that about two, or can we just agree that that's when it'll go into effect?
Well, we need to, yep, I can make a motion.
Okay.
Let me just make a motion for the annual regulations to become effective on February 1st, 2022.
Second.
I second it.
Second.
Okay.
Great. All in favor? Aye.
Hi, Jay.
Hi, Bob.
Ron?
Aye,
Right.
Bernadette.
Okay. Okay. Well, definitely, Diane, thanks for all your hard work. I know that was not an easy thing. It took a long time, as well as you, Donna. I know you had to help out as well. So we appreciate all the hard work, and it's nice that we're updated now. That was definitely a while in
Yes.
coming.
Thank you for everybody's
So-
patience, and thank you, Donna, for your hard work as well. It
Yeah.
has been a long process, but we made it.
Yeah, for sure.
Thank you, Diane.
Yeah.
And thank you to the board for working on this so hard, and I appreciate it.
All right.
Thanks,
Dawn.
Donna.
Thank you. Okay. The consent agenda, the review and approve the meeting minutes for November 16th, 2021, and the budget report for fiscal year 2022. Anybody like to make a motion to approve those consent agenda items?
I would like to make the motion to approve the agenda consent items for November 16, 2021.
Okay. I'll second for that.
I second that.
Okay, great. All in favor? Aye, Ron.
Hi, Jay.
Right.
Sorry, Diane
Hi,
was
Bob.
muted.
I wasn't.
Right. Okay. Yeah. Bart, yeah. Were you at that?
No.
Yeah, as long as everybody was at that meeting. Laura, do you know, was everybody at that meeting?
As long as they reviewed the minutes or the meeting, then they can vote.
Okay,
So-
but I just don't have that meeting pulled up. Was everybody at that one or no?
Which one?
At
I was the only one
November
who was not
16th
there.
Meeting?
I
You
was
weren't there. Okay.
Yeah. Mhm.
See, I was trying to pull it up at the same time. Sorry. Trying to
Right,
multitask.
no, I didn't. I was just trying to make, because it would still pass at least 4-0, but. Let's see.
I have it here, Ron.
Yeah. Yeah, okay, I'm trying to,
Yep, yep.
I'm finally at
Yep,
it.
so Barbara was the only one that wasn't at the meeting for November 16th.
Okay. Okay, so we'll say that passes 4-0 then. Okay, thank you, Di. All right. Raj, you're up. Health Director's agenda.
Thank you, sir. So I just want to update the board first on the grants that we are working on. From the last meeting, we have applied or in the process of applying for 2 new grants. One of them is what the pamphlet we have provided is called NIA's grant. It's basically help us with doing foodborne illness investigations. That is a grant that we have applied from the town department. It's a grant from $2,500 to $4,000. Hopefully we get that. Now there is another grant, the first one from Metrowest Health Foundation grant. That again, we have applied with the other 7 communities in the collaboration in the Metrowest. That's a $50,000 per community grant just for contact tracing and clinics and all that. The good thing about that grant is it should be, if we get it, we will get it in early February, so that'll be helpful, for us to do contact tracing or doing clinics and all that. So we're very hopeful that we get that grant with the other collaboration. That now this is going to be the 4th grant we're going to have with the collaboration. Now, I just want to update board on this too, like, why we are going with the collaboration and not individually is that the sources like the DPH, now they're trying to push all these grants through collaboration. That's how they kind of want public health to function, or, like that's how the monies are coming in. So, and out of these 6 grants, we have already been granted 2 of them. One is the Public Health Excellence Grant, that's $300,000 for 3 years. And the other one is the Contact Tracing Grant, that's $200,000 for next 2 years. Good thing is, the last clinic we have at the senior center, 2 of the members from the grant, like under this grant was there to help us. One was a nursing professional, another one was the coordinator for these grants, so, and there are 2 epidemiologists that are getting on board this month. One is mid-Jan, and the other one is end of Jan. We're definitely going to see a lot of help, and resources moving, maybe like February or March, we're going to definitely be doing a lot of good stuff under these grants, again, in the collaboration for surrounding 7 communities plus Ashland is the 8th one. So this is where we are, 6 grants total, 2 we have received it, and hopefully get the 3rd one and the 4th one, but 3rd one should be coming to us shortly. The next one is the Bellevue Heights. Last board meeting, we informed the board about the rodent issue. We did send a educational flyer to all the residents of Bellevue Heights and a part of Concord Road. And kind of looks to me that it has died down. We have no complaints since then, so I mean, that's a good sign, and we'll still work with the residents. I know Donna went out on a couple of them too, there was some unpermitted people on that road, and Donna also did. And myself also, I went like 2-3 times just to look into the issue. The 3rd item is the market basket, so we did have 2 complaints on market basket about a physical contamination scenario. One complaint came from USDA DPH that a customer found, plastic wrap or something in their prosciutto. We did an investigation on that, and the market basket agreed that it was a fault of an employee, that this is how it got into the prosciutto, But later, this is again, I guess 3 weeks back, we have another complaint. It seems a former Board of Health member found a metal piece in the steak that they bought from market basket, Again, we did an investigation. We did find stuff that have led to such kind of scenario, and market basket have corrected everything since then. But I just wanted to bring it to the board's attention that, hey, we have dealt with it, and market basket have given us a surety that they'll be taking care of this. So, sorry, please.
It might be a stupid question. I apologize for not knowing the answer, but do they pack their own meat there? Like, should they?
That is correct.
Okay. Thank you. Sorry.
And just on the same line, there was stuff that we found that might have led to the contamination. Again, can't say it for sure shot, like that was the reason, but there was circumstances that might have led to it, Okay, it's kind of a difficult situation of one kind of complaint to verify, but we are keeping a very close eye on market basket, given there are 2 back-to-back complaints of a physical contamination, and I'll keep the board posted if anything else comes, I just want to update about the restaurants, so But this is like past month or so, we have dealt with, again, in the two restaurants. One is Erica's, one is Mazzy's. We have one single case each of Campylobacter foodborne illness there that we have investigated, and that have been resolved since. I want to update the board about regarding the permits. 31st was the last day for submitting permits to us. There are two establishments that have, they have not granted permit from Board of Health Department, and they are currently not operating. One is Honeydew, that's at 236 Pond Street. We did have some challenges with them a couple of months back, or early, late November, early December, when there was a change of ownership thing, and they have, I was out there yesterday. I have to go close them because we didn't have an application from them. And after the closure, they did submit an application, but it's not complete. So we are trying to work with them to, complete the application, and so that we can grant them permit. The other one is Kitty Fanwell. I was there today. They have actually earlier, before pandemic, they have a full kitchen and full operations. They have ceased those, but right now they're bringing some food, in form of sandwiches and all that from a private vendor, but they're still gonna need a permit. And I have talked to the manager there. They're in the process of applying the permit, and they are also not operating at this point. Both of them will be paying a $50 late fee, for not submitting the permit application on time. Besides that, we still have some, and this was major permits, like, we have the food establishment permit, the retail permits, or the tobacco permit. Besides these two, we're good with everybody else. Besides the, there are some of our permits are just seasonal, like an ice cream truck, or a couple of seasonal vendors we have, when they come only in the summertime, and we'll have their applications then. But other than that, we have major applications in, and we have granted them permits. Still working on some animal permits, that people have not applied, or installer permits that, some of these companies get it whenever they get job, But most part we are good on our permits. And I'm open to any questions the board has.
I'm good. Anybody? No? Okay. Thanks, Raj. Great update as usual. As far as item number 8, agenda topics for future meetings or the next meeting, anybody with anything pressing?
I've got not an agenda topic, but
Yep.
an unrelated topic. Should I bring that up now, or is that?
Sure. Well, okay. Let's see if we can talk about it.
Okay. So I had mentioned a while ago to this group that I've done some volunteer work with an organization called Remote Area Medical. They're based in Tennessee. They set up these free pop-up clinics. Started out as something that was done in the South, Tennessee, West Virginia, and kind of moved north over many years. And anyway, I'm doing a little bit of digging and reconnaissance to see whether or not we could bring something like that to this area in Metrowest and potentially Ashland. And it takes some doing and many, many months of planning, but I have talked to a few key people in the town that were enthusiastic about the idea. The purpose is really just to set up clinics for vision, dental, and to some degree medical services. These are usually weekend clinics, and this organization comes in and they provide the logistical support, the equipment. They help get the medical volunteers and all of that. So it's a big undertaking, but it's a lot of fun. And based on some numbers and statistics that I read recently about the health status of a lot of the people in Massachusetts most people are insured or some people are underinsured. It could benefit this area, I guess is what I'm saying. And in fact, they were going to set one of these up in Medford, hosted by Tufts University, and that got postponed because of COVID. So this organization would definitely come up here. But what I want to do over the next few weeks is reach out to some folks. Raj, maybe you and I can talk offline about, if this is feasible. And like I said, I've been talking to a few other people. So I just wanted to let this group know that I'm thinking about this, and maybe it doesn't happen, but maybe it is something that could happen. And I'll keep people posted, and I'll provide more information as I get it, and then we can all kind of weigh in on this as we move along. So I didn't want to provide a whole lot of information because I really don't have a lot, but I figured I should at least let folks know some of the early thinking around this. And I'm happy to send off, as I get it, information about this organization to everybody so that you can see what they do and how they roll out these clinics and what they can provide and the benefits.
So my suggestion, Ray, excuse me, Jay, I'm sorry, I guess I'm tired today on a Tuesday night, is Jay, about having it as like an agenda item for next meeting, and hopefully, and then keep it as a standing, could be once a month instead of every other week, but and keep it, as an agenda item for yourself, because then each meeting, you can just give us update, or like I said, or once a month you can give us updates, because I think that would be, it sounds really like an interesting thing. And I know, of course, Raj, I'm sure, would be up for it. And, Sergeant Berman, he doesn't have anything else going on. He'd love that as well.
Well, Ed's on my list of people to talk to. I've got a small list of key people that I would really need their buy-in in order to get this going. I don't want to approach the organization until I have that buy-in first. And then I agree. I think that'd be great, Diane. I would just set aside make an agenda item and then just keep the group updated as it goes, because then
it leaves it an open spot for you to discuss it, at a meeting. Exactly. That's awesome. That's great.
Okay.
Yeah.
Nice.
I mean, you can do that. That's great.
Yeah. Okay. Well, I'll let you know more about it. I didn't want to take up too much time here, and I'll be talking to Raj and Ed. So, okay.
Yes, sir.
I was just going to say, at the next meeting, I may or may not be there at the next meeting. But the next meeting's the 8th. We're planning on meeting at the 18th.
Should be the 18th. Yep.
Okay.
All right. Anybody thinks of anything between now and then that they want to put on it? Jay will definitely get that on. Not that you'll have any updates then, but that's great.
Okay. Thanks, Ron.
Ron, Steve Morgan.
All right.
Has his hand up.
I don't know if Ron could see.
Yeah. Hey, Steve.
Hey, good evening, everybody. Thanks for recognizing me, Ron. I just I missed the earlier part of the meeting with the citizen participation. I did have an inquiry I wanted to make the board aware of, and I'll just take a minute if I may.
Sure.
Yeah, so I understand this board was involved with the town noise bylaw a few years back. And there is a town noise bylaw, which includes certain health and safety aspects under OSHA and noise levels around town. I think there was some activity actually to get some noise meters, maybe over to the police department in cooperation with the Board of Health, some years ago. Anyway, a situation has now developed near the Mendez School behind my house and next to the school, which is now in session, where the construction project has started to use rock breakers. And this has been going on all day. dB levels are clearly above, I don't have a meter, but are clearly above what's allowed. I can hear them here in my downstairs home office, quite loud. Can feel the vibration of them. They've, for some reason, decided to truck all the rocks down in the corner behind the school along this property line before they start breaking up boulders into little smaller rocks. And so, I'm just reaching out to the Board of Health. I think that's an issue. Obviously, that construction project should have a safety officer and should be keeping its noise level on its property. I do understand the noise bylaw has certain exemptions for town contractors in terms of when they can start work. but I don't believe they're allowed to violate the OSHA levels without safety equipment. And this has been going on all day. It's probably going to continue tomorrow. I did reach out to the town. I understand town council may have a discussion about it, but the initial feedback I got was they feel they're exempt. And, you know, again, an OSHA noise level is an unsafe condition. It's not just myself, the kids in the school are in a similar distance from this activity. And I think somebody needs to actually look into it. I'm not trying to say what it should be, but I want to make sure you're aware of it. It's a new thing that started today as they start breaking boulders into smaller rocks. And I don't know why they chose to drag them over toward the buildings. Most of them seem to be coming from the far side of the site, but they've decided to do this, you know, essentially 100 feet from the back of my deck. And it's loud and continuous. So that's my comment. I would hope someone on the board can look into it. And I'd be happy to answer any questions. And I think it would affect the kids in the school as well.
So if I can just say, I just, you know, I know Steve knows that I have multiple hats, one during the day and one in the evening, but the Board of Health actually was not instrumental when that bylaw went through, because I obviously been involved in a few years. I know it was the select board was very involved, and the police department was very involved because they're the enforcement authority. And the meter was purchased for the police department, not for the Board of Health. And I, as far as I am aware, they still have it.
I suggested that to them today, and they
Okay.
indicated they have it, but they weren't willing to come over and use it because they were concerned that the town might not need to follow those rules.
Okay, and I don't know any of the exemptions of the bylaw or anything like that. I just wanted to make sure that you knew that that's who to call to enforce the bylaw. But
Yeah, I did make the call, and I talked
Okay,
to the
good.
sergeant over there, and he said he ended up getting told to talk to town council tomorrow.
Okay.
And I do understand there's an exemption around the 7 o'clock start time for noise. This project has been starting at 6:30, been noisy in the neighbors, but there's nothing we can do about that due to that exemption. I don't believe the exemption applies to the noise level. It only applies to the time. But, you know,
That's
obviously.
fine. I'm sure. I'm sure if you've made contact with those people, they would.
And given the history of it, and I know you were involved, I know that meter was purchased, and I think KG, one of your former members, was involved in this issue as well.
Yeah, we didn't like sponsor the bylaw or anything like that. That's where I was going with that is I think it was a select board bylaw that went into effect. It was either them or the police department. But.
And I agree with you. And I think planning did limit their time to 7 o'clock, but there's no way to enforce the 6:30, 6 o'clock start and the noise because they're exempt according to the bylaw. So they are not following the planning decision, but they're, this is different now. As of today, they're making, I would estimate over 100, 110 dB noise constantly all day with that rock breaker. And, at the distance I am from the noise and I can hear it at that level, if they were doing it now, you could hear it on this conference call. And I'm in my lower level office, several walls away. Not to mention.
Well, I'm gonna make an assumption that you probably made the appropriate calls today, and they're gonna hopefully take care of that for you. So
I made one phone call and they did not come out. They told me town council would discuss it tomorrow. So the police refused to use the meter and take a reading.
okay, so they must be the ones that are gonna try to counsel. But I mean, as far as I know, the board doesn't have any enforcement, but we can,
I was of the opinion that someone should take a measurement and they would at least have some facts for that meeting tomorrow, but people were told otherwise. So nobody.
Yeah, and it doesn't, again, I know I'm not telling you anything you don't know. And I feel like, I don't want to beat a dead horse on this because I've already beat a dead horse on a couple of the subjects tonight. But obviously, who their boss is too. So, but we can't tell them that they need to do something.
And I know the police department doesn't enforce OSHA. I haven't started calling OSHA about the noise level. I'm hoping local board of health can address it. It's a health.
We don't, but that's, well, again, we don't need to beat a dead horse, but we don't address that either.
Well, you have kids in school and they're getting the same noise I'm getting. So I don't know if they'll take action or not, but someone ought to go measure it with a meter, get the facts, tell them to move the activity away or whatever the right thing is. I'm not trying to make a big deal out of this. Obviously, I'm not really big in favor of the project, but I don't believe that what they're doing makes sense from a public health point of view. So that was my comment. Thank you for allowing me to speak.
Okay. All right. Thanks, Steve. All right. Well, we can
right,
try to look into it. I guess I would just wait for the town, for the
yeah,
for the
I'm
lawyer
assuming
to
somebody's
take a
going to
look
talk
at
to
it.
council tomorrow.
Right.
Well, I would like
Okay.
to make the most important motion of the evening. I'd like to make a motion to adjourn
Yep.
the meeting at 9:22 PM.
Yep.
Excuse me, I can tell I'm tired, 7:22
Is that-
PM.
Tired.
Thank you, I'm
I'll
sorry.
Seconds
second it.
can look like nines at this point. Anybody want to second that?
I'll
Second.
second it.
Second. Okay, got 2 seconds. All right, all in favor? Aye.
Hi, Jay.
Hi,
All right.
Diane.
Thanks, everybody.
Have a good night, everybody.
Right.
Happy New
Good
Year.
night.
Good night.
Raj.
Thank you very much.